Welcome to the She Found Motherhood podcast. It's Dr. Alicia, and today I was lucky enough to talk with Janette Yee from Ask Janette on Instagram, all about C-section scar recovery. Janette is an athletic therapist and registered massage therapist who specializes in the preparation for cesarean sections and the recovery after, both for athletes and non-athletes. However, she calls all pregnant people and birthing people athletes because of the amazing feat that they've done. So everybody's an athlete. We discuss how to help with desensitization of your scar. So if it's feeling numb or if it has some weird sensations, we discuss a little bit about that. And then we also discuss how to do scar massage. So if you're getting what is known as that C-section shelf, and we kind of describe what that is a little bit in the podcast, how to help decrease that or decrease the risk of it. So really great episode. Janette is so much fun, and I hope you guys enjoy it as much as I did.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Janette, I am so excited to chat with you today. We're talking about a subject that is specific to people who've had cesarean section. We get lots of questions around my scar is sensitive or how can I prevent that C-section shelf. So you're coming on to talk to us today a little bit about that topic. But before we get into it, I would love to hear a little bit more about you and how you've come to do the work that you do.
Thank you so much, first of all, Alicia, for having me on. How did I get this started? My background training is in something called athletic therapy. And most people don't even know what that means. They've never heard of it. So for 20 years, I worked with athletes of all kinds, specifically rugby athletes. And Alicia, I thought rugby was like the toughest, most hardcore sport I'd ever seen. And Grant, I played rugby, competitive rugby for 15 years as well. I saw all kinds of injuries, but oh my gosh. Then my athletes started families. And when they were pregnant and then when they gave birth, I was like, this is definitely the most hardcore sport I have ever seen. Who plays a sport that lasts for 9 months and ends in like a season-ending injury? I couldn't even believe it. So I was like, okay, there really needs to be a lot more care with regards to this crazy sports injury called childbirth. And then specifically cesareans. I was like, what is that all about? And why is there absolutely no, again, from an athletic therapist standpoint, why is no one prepping these athletes for surgery like any other orthopedic surgery? Why don't these athletes have any follow-up rehabilitation plan, which is clearly defined and know exactly where they go to get it and how long it's going to take? What on earth is actually happening here? So I went from working as an athletic therapist with rugby athletes to the most hardcore athletes out there, which are moms. And as a mom myself, honestly, it is the hardest sport I've ever played.
It sure is. I took my kids to a rugby match. We live near the university in Victoria, and so I've been taking them to a couple of like athletic sporting events. Holy cow, holy Batman. I called my friend who's an orthopedic surgeon, and I was like, are you on call right now? Because I feel like this whole team is going to be coming in to see you. It's crazy, bonkers, bananas, that sport, but very cool sport, but very rough. So the fact that you think that the birthing and parenting people are tougher than them, yes, I would agree with you 100%. Okay, but I do have a question because Janette, my understanding is you actually had 2 vaginal deliveries. So what has actually gotten you to focus on the cesarean section prep and recovery in people?
So here's the thing. I was told by my 2 physicians, well, actually I had physicians and midwives here in Ontario, you had a very textbook birth. And which is great from a medical perspective. But Alicia, from my perspective as a perinatal therapist, as someone who can navigate the medical profession, as someone who knows my body really well as an athlete, I had an exact opposite experience. I was like, there's nothing textbook about this. Everything is leaking. I don't know what to do. I thought I did. And then I tried it and it doesn't work. I'm too embarrassed to ask for help. And then when I tried to ask for help, I didn't get the help I needed. And then add on top of that, postpartum depression, which first time around went undiagnosed. Second time around, Elisa had some more support. But when you have postpartum depression, you're not, you're not yourself. My second baby was born with a physical disability. Some of your listeners might know about clubfoot, but it's all in. It's bracing, it's casting. You got to figure like everything. How am I changing their diaper? What clothing? It was not about me. And those vaginal textbook births shouted and screamed at me. Oh my gosh, if it was that easy for me, what on earth is happening to people who have been cut wide open after a cesarean? So then I was like, who's advocating for these people? And I looked and I searched and I researched. Oh my gosh, Alicia, I did not find very much at all. So I was like, someone needs to lead. And that's my calling.
It's really interesting because we have some social media posts. Sarah and I are very much about empowering people with the knowledge that they need to make decisions and knowing what the potentials are, because pregnancy and childbirth has historically been one of the more dangerous things that we do in our lifetimes, those of us who can birth children, right? Now, because of all of the advances of medicine and the support, that's why midwifery came out in the first place, to help support people to birth more safely back in the good old days. Like, that's why it all started. People get so upset about us telling people these things and maybe warning them about the possibility so that they understand it and can be prepared for that, so they can make the good decisions they need and not be surprised in the middle of an already emotional, exhausting period of time, right? And one of the things is for cesarean sections, right? It's a major surgery. And we know in Victoria, anyways, about 27 to 30%, a bit higher with midwifery patients, a bit lower with family practice patients for some reason. I do not know why. Those are the numbers of people who get cesarean sections in our community. And there's lots of reasons around that. But to prepare somebody for that recovery, it's almost I think people get more frightened. And it's navigating how to best prepare people for people who are not planning for a cesarean section. So I know you have a program around people who are actually planning for a cesarean section for whatever reason. Repeat cesarean section, they've got a breech delivery, they've got placenta previa, whatever it is. But for the population who are hoping for vaginal birth and end up having a cesarean section, how do you prepare them for that? It's hard to, right? And you can walk them through the recovery. We don't do a very good job around that. You are 100% correct. So thank you for the work that you do. But it's a challenging thing. So I'm really glad that you have taken this on and are doing this work. For people who have had a cesarean section, the more common questions that we get are, one, either my scar is super numb. Is it always going to feel like this? Or two, it's actually pretty sensitive. And it's weird to touch. When my underwear touches it, it just feels bad. That's one of the issues. And the other one that people get is the skin that is cut. And then we go through the fat that's underneath the skin. We all have it. It's totally normal. And then there's a layer of kind of fascia. It's like this connective tissue before you get underneath to the organs. So those are the kind of the close layers. And sometimes that skin scar can get caught to that fascia scar, and people can get like that C-section shelf. And people are quite worried about that. So that's the other thing that would love to chat with you about today. So I'm going to stop talking and let you talk about what you're passionate about and your expertise.
Let's talk about this. So sensitive numb scars and C-section shelf. It's interesting that you mentioned these are the two most common questions you receive as a physician, because as a perinatal therapist, they are also the most common questions that I receive as well. And just like a philosophical wonderment out, maybe we need to talk about this when people are pregnant. Just like, these are things like, it's not just, by the way, vaginal birth, you can experience what looks like a shelf as well. I find with my athletes that I work with, the knowledge is power. Knowledge is power. Pregnant people, I always say, listen, 30% chance your baby's gonna come out the front door, not vaginally. Do you want to know a little bit about that? Because here's the thing. So I actually have a couple of resources that I point people to, because you're right. How do we start educating when people aren't even thinking of the question to ask because it never even came up? So that's how I do it. So I actually, it's funny. The resource that I have, it's called Cesarean Birth 10 Things Your Doctor Wants You to Know. And I should actually send this to you. And I want you to tell me if these are things you'd actually want your patients to know. But let's talk about that sensitivity and numbness that happens after a cesarean birth. For anybody listening here, especially if you haven't had a cesarean and you're listening, you're like, what does that actually feel like? So if you think about any major surgery, any incision you've ever had that required stitches, as it's healing, it feels well different. It feels strange. It feels maybe tingly. It feels numb, but hurts at the same time. You're getting all these different messages into your brain. And how I describe it to my athletes is, well, when you've been cut, when there's an incision that happens during surgery, it's not just your skin that's cut, your nerves are cut too. And they may be trying to grow back. So as they do so, they're getting all these strange kind of sensations. So how does scar massage help? So as a perinatal athletic therapist, I do talk a lot about what can my athlete do on her own to help herself heal. And scar massage is one of the big things. So, with a sensitive or numb incision, and this can be at the very beginning, like days, just a few days postpartum, but even months after, the following thing that I'm about to describe can be effective. So, desensitization massage techniques are exactly what it sounds like. You're trying to decrease the hypersensitivity of the area. And, or if it's numb, you're trying to bring back sensation because those little nerve endings are trying to grow back and they're trying to understand what they're supposed to be telling you in terms of, oh, this is sharp, this is dull, this is cold, this is hot. The first thing you want to be able to do is feel comfortable having something contact the incisional area. And I love telling athletes, by the way, it's an incisional area. We only see the one external incision, but there's quite a few more things going on below the skin. So I always describe the three major incisions, and I'm sure, Alicia, you can describe it way more in depth than I ever could. But I do describe the three. There's one traditionally horizontal external incision, the one traditionally vertical down the linea alba, and then, of course, there's one through the uterus, which is deep in our organs. But when we're talking about desensitization massage, friends, we're talking about the skin. So superficial. We're not trying to push deep at all. So if you're listening and you're like, I want to try this, but I'm nervous. Oh my gosh, it's going to hurt. It's going to tear things apart. It won't. It's very superficial. If you are, let's say, wearing something on top of your pants right now, let's try this all together. So everybody who's listening, I would actually say, bring awareness to the area first, because it's so important to be comfortable with feeling and receiving sensation before you can say whether or not what you're doing in terms of massage is helpful. So right now I'm wearing pants, for example. I'm wearing pants over where my incisional area would be. And I would be able to feel, oh, is this tight? Is this warm? Is it tingly? And we're trying to use observation words, not emotionally loaded words, such as, this feels gross. I feel fat in these pants. My pants don't fit in, this is making me feel XYZ. So we're trying to use observation words. Next, if you're feeling comfortable with the contact of your pants on your skin, but you're not feeling comfortable with your hands on your skin, try this technique. So I call this piano keys. And if you've ever played the piano before or you've watched anybody play the piano, it's literally like you're just tapping on the keys. We're not trying to press the keys. You're just tapping on the top, not making any noise. So if you can do that over the top of your external incision and around, above, and below, closer to your pubic bone, don't forget the sides, just tap along. And what you're trying to do as you're doing this is, again, observe. So ask yourself, as you're around the area of the incision, so at, above, or below the incision, what does it feel like? There's no wrong answer. And then tap the area of your abdominals above the belly button. So if you can all do that now, tell me, ask yourself, what does that feel like? Again, there's no wrong answer. But what I'm trying to explain to you to really observe is that if there's a difference between the surgical and the non-surgical area, then you know that this technique can be helpful. So it's a pretty simple technique, but a very impactful technique. So piano keys is one of them. And piano keys is most impactful on your bare skin. So any listeners who want to try this on your bare skin, don't be shy. Get into a room, whatever, by yourself. Pull down your pants, pull down your underpants, get on your skin, do the piano keys. Compare the surgical area to the non-surgical area. And then you're probably going to ask, how long do I do this for? Just, you know what? Just be curious. So I tell the athlete, if this is your first time, just be curious. Maybe you do it for a few seconds. You're like, I've had enough. This is the first time I ever touched it. But if you've done this a few times, or if you're feeling quite confident, do this for 1 minute, 2 minutes. Do it subconsciously. Do it when you're watching TV. Do it when you're on a call or on a podcast recording. Do it where people can't really see what's going on, but you're still creating a beneficial environment for healing. So more frequently is always better. Long period of time, we're not looking for long duration, we're looking for more frequency. So that's one example of desensitization massage.
Awesome. Thank you. That's great. I love that piano keys. And you guys can't see Janette, but she's like moving her fingers in the piano key ways. It's really quite lovely, quite soothing actually to me. Okay, so we've gotten that and we're starting to get more comfortable with kind of, and you're right, the nerves are all cut and they take the time to regrow. And so you will have numbness, probably half a centimeter above and below that incision for quite a while. I think mine, it was like a year until I could have normal sensation over my C-section incision. And that was fine. And I knew that and I knew to expect it. So it wasn't a big deal, but it was different than I had anticipated, which that's the thing. You can prepare people, but it may not feel the same to you as it does to somebody else. And that's okay. But if it's really bothering you or is really hurting or is impacting your life, that's when you need to talk to your care provider, whomever that is, athletic therapist, physician, midwife, doesn't matter. Just talk to somebody about it. So that's your number one, first few days to weeks. What's next step on your plan?
Yeah, I was even going to say, with that desensitization technique with piano keys, it itself has a progression of different massage techniques. So if your listeners are like, well, I can do piano keys, it feels different, but this is easy. Like I could do something more. The answer is, yeah, there's actually more. A progression for desensitization would be using different textures. So let's say you're in the shower the next time. Different textures would be things like a nice soft terry cloth towel versus a loofah sponge, which is a little more scratchy, versus an exfoliation mitt, which is definitely scratchy, versus those, what are those tools which you take off the dead skin off your heel? I'm not suggesting you scrub your incision, but I'm trying to describe that there's a lot of different types of textures that if your whole body, your skin is everywhere in your body. If your skin on your belly above your belly button can decipher the difference between these textures and feel totally confident with receiving these textures, then what your goal would be for desensitization massage would be the surgical area would also feel the same or similar. But to your point, Alicia, it could take up to a year before or more. Every body is different before full sensation return. But I do like introducing desensitization massage even before the 6-week mark, because it's something that we can do to gain confidence in feeling safe about touching our own bodies again, and in a healing way, in a curious way.
For sure. And doing that kind of, our nerves and our nervous system is a fascinating organ. And sometimes it gets confused by the signals it's receiving because it's not what it expects. And then in some people, pretty rare after cesarean sections, but certainly can happen, you can get these chronic pain pathways, which are really hard to break. And so by doing this type of work, you can help almost, I'm using quotation marks here, train your nerves around your cesarean section as to what it's supposed to feel, right? You do the comparison and, oh, that's what it's supposed to feel like. Okay, that makes sense. Rather than your nerves that have been cut, because they have been, being trained in a different way that's not going to be serving you well for the rest of your life.
I would agree with that. I do like to highlight the point, as you're saying too, the comparison part is important because I'm a therapist, but it really didn't even really help. I'm a therapist in the point that I have trained hands that I know what to feel for. But when it's on your own body and you're also learning to be your own therapist, I think it's very important to understand that comparison is a good tool so long as you're comparing your own body to your own body. It is important to use that because we have to know what's safe. It's important to use that because we have to know, hey, is the technique I'm using effective? Am I doing it right? Is it too simple now? Do I need to progress it? So it is very important. That comparison tool is actually a very important tool to use for the layperson, the non-therapist.
Yeah, and in those first few weeks, just a reminder, we're just doing light touch. We're not taking
Mm.
that loofah and scrub-a-dub-dubbing. No, no, no.
No,
We're just
no,
placing
no.
light touch. We're just getting used to different sensations. This is not a big pressure thing because it does take time for those layers to heal. And so it takes usually about 6 weeks for our inner layers. The skin's usually faster, but our inner layers to actually truly be healed. And that's why we recommend people not lifting anything heavier than your baby for the first 6 weeks and just slowly progressing into exercise because we need to make sure that those inner layers, those really supportive layers, because your kid's skin is not supporting that much, but the fascia is really supporting a ton, needs to be well, solidly healed before we are progressing into kind of back to quote unquote normal stuff, right?
Absolutely. I think on a separate podcast, we can talk all about things like ab wraps and compression garments and how those can be used to really support the healing of these inner units that we don't see. We can feel the weakness. We can feel the dysfunction. We know comparatively, oh man, I can't even hold my baby for 10 minutes. And how in the first 6 weeks, protective strategies can be very useful too.
Is this pain I'm feeling in my pelvis normal? Should I do genetic testing for chromosomal differences in my baby? Is it safe to go to the dentist while I'm pregnant? Doctors and maternity specialists Sarah and Alicia are here to empower you with even more knowledge so you can have the best pregnancy, birth, and postpartum experience you can. Presenting the Pregnancy to Parenthood podcast, a new series of informative episodes geared week by week toward whatever trimester of pregnancy you're in. Tune in weekly, following along relevant topics as you move through pregnancy, or just binge listen and come back to the episodes you found most helpful. Access the full series for a full 2 years and listen to it on your own time. To learn more, go to www.shefoundhealth.ca or click the link below.
So we've kind of talked about that scar desensitization or working with kind of the nerves and allowing them to slowly heal and just getting used to what those feelings are and getting comfortable with our body. And I like that that's a really important piece of it, I think, because a lot of people are scared, right? Whether you had a vaginal delivery or you had a cesarean section, people are scared of what happened. How do I know if it's healing normally? What does it feel like? I don't want to look at it. And it often, vast majority of time, people, it feels worse than it looks. I can almost guarantee you that for the vast majority of time. So don't be scared if you're curious to have a look, either at your C-section, and sometimes you got to pull up your jelly belly because remember, it took 9 months to get it that big. It takes time for everything to come back together, and that's what you're talking about. Those ab muscles need to shrink down. You need to get your core back. So even that you have a jelly belly, that's not going to stay like that. It just takes time for our bodies to rest and recover and recuperate like we do podcasts with a pelvic physio with any other musculoskeletal injury. It takes time. So we've gotten to that 6 weeks mark, right? What's your next step on scar massage? So we kind of have talked about the desensitization. So why don't we go on about that scar healing and that kind of C-section shelf that people are worried about?
Oh, yes, the C-section shelf. So I want to actually ask you, there's no medical term for it, is there? Because this is the layman's term that I've always heard and I use, but very begrudgingly. Is there a medical term for it?
Depends on what people are actually talking about, because there's an
That's all.
area where the incision on the skin is a natural area of flexure of the skin. So if you, like I'm sitting here, I'm not a fat person. I don't have ton of extra body fat, but naturally the area that my C-section scar is where my stomach folds when I sit. And so it's just a natural area of flexion there. And so I think a lot of people who still have a little bit of baby weight, or maybe you just have a little bit of extra subcutaneous tissue, totally normal. That's where it naturally flexes. And so I think people then assume it's a C-section shelf, but it's not necessarily. But where it can be, quote, that quote, C-section shelf, my impression is it's when the scar between the fascia, so that deeper layer of connection, which if you flex your abs, you can feel, and the skin have almost healed with scar tissue in between them. So it's not super mobile and it can't move. So it's almost tethered down to the fascia underneath it. So that is what my brain goes to with kind of C-section shelf. And that's where my brain goes to where scar massage would be super helpful. And that can happen with any kind of scar if you've had something underneath and it's close to muscle or fascia, especially underneath. Like I had a little knee surgery and I'm trying to mobilize my scar because it's a little bit tethered to the tissue underneath it, just because I didn't do a good job of scar massage, Janette, because I didn't know about it. So I think there can be two things, right? I think there's the natural skin flexion, which our belly just happens to fold over on, and people who've had a cesarean section say, well, that's a C-section shelf, but it's just our natural bodies and the way that we're made. And then there's the actual tethering of the scar tissue, which I think is where scar massage can help. Does that make
You're
sense to
absolutely
you?
right to highlight that. Yes, yes. Because people talk about, oh, a penis or other slang terms. And so I would love to actually define what I mean by C-section shelf. For anyone who's listening, this is not a medical term, but if you do search it, it comes up. So the way I describe it, so Alicia's totally on the ball. So like from a therapy standpoint, that's how I would describe it. From a layman's term, I usually just say it's when the scar tissue heals tighter than the tissues above and below it, creating a shelf-like appearance. Yeah, things are stuck. Things are stuck, things are tight. So, yes, if that is what is causing the C-section shelf appearance, then absolutely scar massage and fascial mobilization can be helpful. But I kind of want to highlight that there are actually many causes of this shelf-like appearance. I can think of 8 right off the top of my head, and only 2 of them happen to be like musculoskeletally related. Everything else is, with what's your garment? What garments are you wearing? What's your hormonal profile? What are your stress levels? What's your nutrition? Like all these other things. So I want to highlight that more than 8 causes of the C-section shelf. We're just going to talk about the tight scar tissue and the fascial adhesions, which is how scar massage can help. So if anybody's interested in the other 8 causes, I think, Alicia, we can link a free resource about that at the end of the show notes today. But yeah, let's talk about the scar massage. So again, scar massage. Now we're talking about direct scar massage. We're not doing this over your pants anymore. And we are talking about an intention of your massage that's deeper than skin level. So this is scar massage. It's not piano keys superficially. The first thing that a lot of moms will say is, oh my gosh, you want me to do what to my scar? I can't even look at it. Like the thought of it makes me nauseous. So to that, I say, you're absolutely not alone. And also, scar massage is not your first step. We need to acknowledge the psychology of healing, which is the first step that any athlete with any injury actually should and would do well with addressing first. Without getting too much into it, it's when someone is excited about their rehabilitation, when they're educated and know what's happening and they're given agency in their own healing and they know what they can do to make a difference and they can see and know what the end result is and when that may actually occur, that's when healing does really well. And that's mindset stuff. That's not even mindset, that's just knowing. And of course, mindset is part of that. So that's what I mean by psychology of healing. So mamas, if you're in the state where I can't do my own self-massage, that's okay. There's other stuff that would be awesome for you to start with first. But for those of you who are like, yeah, let's get into this. So let's talk about this. So again, I am teaching lay people how to be their own therapists because the benefits of scar massage is literally if you could do it every single day for just a couple minutes a day, your outcomes, friends, is way better than seeing someone like me even once or twice a month. Like your own layman's scar massage is better than a professional's scar massage because you can do it every day. 24/7 care is always better than 1 hour a week care or 1 hour a month care or what have you. So that's number 1. Get excited about your scar massage. Number 2, scar massage looks like this, and it's different for everybody. But the first thing I talk about is, okay, I'm going to do the back of my hand. So Alicia's watching me. We're on a Zoom call here, but if you put your fingers on your skin, first of all, I teach massage with no oils, no lotions. You actually want to get a drag of your skin. So Alicia can see that I've got my hand on the back of my hand and I'm taking that skin and I'm dragging the skin. So the skin is itself quite a few layers, 7 or 8 layers. And then underneath that, you've got fat. And underneath that, you've got, well, the fascia is everywhere. So all of these layers have to glide on each other to a certain extent. So friends, if you have your fingers and you could put your whole hand on your belly, you can put 1 or 2 fingers, it doesn't matter. The point is, can you contact the skin, take it and drag it in circles? So I call this technique small circles. It's not very creative, but that's exactly what you're trying to do. You're trying to drag your skin in small circles. Let's say you're going clockwise. Can you drag your skin in small circles? Is it a circular pattern? Or do you notice that, oh yeah, it's definitely circular in one section and then, oh, it gets stuck and it's hard to drag and it's, oh man, it's more like a D. It's not, oh. So these are the observations that you want to make on yourself as you're doing these circles. And you might be asking, Janette, am I doing these circles on my like actual incision? Am I doing it above or below or to the side? The answer is all of the above because your stickiness or the adhesions can happen anywhere.
Can I
Now,
just make a comment on that? Because that's an excellent point. So a lot of people don't, because they haven't seen a cesarean section, don't realize that and this is another question we get a huge amount of, don't realize that the actual incision on the fascia, which is the connective tissue below the subcutaneous fat, which is below the skin, is about an inch higher and an inch farther out than your skin incision. So you've got about a 1 inch difference between where the skin incision is and then up above that's about 1 inch higher and farther out on either side. And people often come in, generally speaking, it's right-sided, except for our surgeon who's left-handed, then it's on the left side, that they come in with this pain post-cesarean section, just very much a pinpoint pain because that's where they do like this anchoring stitch. They do what's called a corner stitch and they stitch that super tight just so they make sure that they get the corner and then they do the rest of the incision and tie to that anchoring stitch. So when you're doing scar massage, you need to be making sure that you're hitting the incision, but also you can go below too if you want, whatever. But make sure you're doing it about an inch above as well, because that is where the actual fascia scar is.
why is that? Oh my gosh, I need to ask now. Does it just not line up after the baby is born? And so it's lined up initially or
Nope, it's never, well, I mean, there's a whole pregnancy, like the whole pregnancy is down, so everything kind of shifts, but it's just
yes.
where the fascia
Right.
needs to be cut. And so they want to make the skin incision low enough so that you can quote unquote wear a bikini. So the lower it is, the less visible it is. And that's what people prefer. They don't want a big incision across the middle of their belly button, right? So they try to make that as low as they can safely. But then to get through the fascia, they need to go through the appropriate part, which is generally about an inch higher.
Look at this. I'm interviewing you in your own podcast. Wow. So this is so okay. See, as a non-surgeon, this is also really great to know because you feel certain things with your hands and you feel okay, here's the thing. Let me back this up. For the lady person who's doing their own massage, there are two things you're always feeling for. So as a therapist, I know this and I would do this intuitively, but the two things you're feeling for is what is my pain? And pain is like sensitivity, stretch, like pain, all different types of pain, but that falls into the same category. The second thing you're always asking yourself is, what is my mobility? Meaning, how well does this area move, especially in comparison to a non-surgical area? Again, I always use the area above the belly button. When I'm a therapist touching your skin, I can easily feel where things move and where things don't move. I can't feel your pain. But for you, when you're doing your own massage, you can definitely feel your own pain. And that oftentimes masks how well you can sense how well something is moving. How well something is moving is a trained skill. So, friends, if you're trying this right now for the first time, you're like, I don't get it. I don't feel a difference. That's okay. Listen, I've done this for 20 years. So, you've done it for 20 seconds. You're doing really awesome. You're doing really awesome. So, trust yourself when you're like, oh, what does that feel like for pain? Scale should be 0 out of 10 when you're starting this right off the bat. Okay. Different techniques. You want different pain levels. Of course, more advanced techniques. I actually want you to feel like a 4 out of 10 pain. I want you to feel that fascial pulling. I want you to feel that, but not when you're just starting. But the mobility is like, how well does something move is great for you to really hone that skill at the very beginning. So if you're just starting out, if you're like 6 weeks post, you've just been discharged by your physician, but even if, you're 6 months post and you've never heard of it until just now, or even a year post, what have you, the first thing you're always trying to hone is like, what's that mobility? How well is that moving? Test the area at the incision, above the incision, below the incision. Don't forget the sides. And if you're doing this very fancy technique called small circles, make sure you're doing small circles clockwise and counterclockwise because stuff needs to move 360 degrees in every plane. And, that's where we would start. So if you're someone who's type A like me and you're like, well, I need to know how many times do I draw a circle and where I do this for how long, the answer would be 5 small circles in one direction, 5 small circles in the other, and cover the entire length of your surgical area. So again, the more fingers you use, you're going to cover more area, which means that you can complete your scar massage quicker. But nothing's wrong with using one small finger on one small area. When you finally discern, hey, I'm moving on my left side, but not so much on my right, then you can focus your massage efforts more on the one section that needs it.
Awesome. That is a great starting point for all of our listeners if they want to get into scar massage. Now, you have a resource around kind of the safety first scar massage, right? And it's a free
Yes.
resource. And so we'll post that in our link below so that people can get a sense of what you're talking about and what they need to remember. I'm assuming from a safety point of view.
Oh, absolutely. Yes. It's like massage therapy 101. So it's useful for both professionals and for the layperson. It's easy to follow. Just keep that in mind and the chances of you hurting yourself becomes much lower.
Awesome. And anybody listening to this can really hear the passion in your voice and the fun with which you also approach it. And I love that you call all of us athletes. Thank you for that. And so you actually have some courses and you have a great Instagram account that we follow, and Sarah's been on your Instagram account a bit as well. So why don't you tell us a little bit about where people can find you and the courses that you have, because you're right, we do not prepare people enough for cesarean section and we don't support them enough afterwards. In Victoria, we actually see people quite frequently postpartum. So I think we have a realistically better support system than a lot of other places in Canada, but I know some people only do a 6-week check. And so how can we better support people? And I think you are one of the ways that we can do that. So why don't you tell us a little bit about where people can find you and then a little bit about your courses that you have?
Amazing. Well, we're all a team together, aren't we, Alicia? Where you want to count on me in a surgical theater. I defer to you for that as well. So so where do we start? Instagram. I love being on social media. So if you love the gram and if you love TikTok, I'm there all the time. So my account for both, my account name is Ask Janette. Because you can ask Janette all your questions. And as a matter of fact, I go live every Monday at 2:15 Eastern. That's what I've been doing anyways for almost a year. And the idea there is you can ask no question is too small. The point is this, I do this because literally I feel perinatal therapy needs to be accessible. And when people have access to the internet, then they should be able to ask questions and find answers from a professional. This is why I do it. So come on board, come on to the Instagram or TikTok live, ask your questions. And that's me every Monday. My website is JanetteYee.com. There are a lot of resources there, but that's also where you're going to be able to find information about my programs. So my program for pregnant people, but also for people who just had a cesarean, they're like, what the heck is going on? I have something called the Cesarean Birth Preparation Course. And it's not a course. It's like an hour and a half workshop where I encourage you to watch it, but also have all your support people watch it. Because did you know you can set up your house ahead of time so you can get in and out of bed without, tremendous pain? Did you know that there are some underwear that you might want to consider wearing over other types of underwear? You can get that ahead of time. Like, did you know there's like compression wraps and like maybe icing strategies and stuff like that? Like you can do this all set up ahead of time. And so whether or not you're expecting a cesarean, this is, I think, one of those great, really quick, short workshops just to take a look at. And then if you have had a cesarean birth and you're like, okay, now what? I've got 2 online programs for that. One is a foundations program for the mom who wants to return to pain-free living, or for the mom who's already doing, let's say, I'm working with a personal trainer, I'm already doing some diastasis program and this kind of thing, but I want something specific for my cesarean. So that's my foundationals rehabilitation program. It tells you your scar massages and the movements that would be great for you to do. But if you're an athlete, I have a cesarean recovery for athletes program. And this is for the active individual, someone who wants to get back into exercise at any level, and someone who certainly is returning to sport and competition, any sport in any competition. So that is a more in-depth program, which also includes a complete diastasis recovery.
Amazing. So good. So we will link all of those in our show notes. And then on our website, we actually have our favorite courses page. So we'll put them up there as well with the links. So if you guys are looking to find out where you can learn more about those, check out our links in the show notes below or our website. We'll make sure we have all of that up and going by the time this gets released. Janette, thank you so much for joining me today. I learned lots. You learned one piece of information, and that's why we do this. There's so much learning that we get from each other, and you're 100%. It's a team that we need to come together around our pregnant and postpartum people to support, and we don't do that enough in the world in which we all live. And so that's part of why Sarah and I do this, is because we get the opportunity to learn so much from each other and make these connections and help support our patients more effectively. So thank you again, and thank you for your enthusiasm and your obvious true love of the content in which you speak.
This is awesome. Thanks so much for having me on.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.